Hello and welcome back to Mother Tongue, your eyes, ears and finger on the pulse for all parents around the world. Let's get going, shall we?
We are so incredibly excited to welcome Melissa Schneider to Mother Tongue. Melissa, how are you?
Hi, I'm good. How are you?
Yeah, very good, thank you. I'm so excited to have you today. I'm also genuinely so excited to hear more about your brand and your story. But before we get into all the good bits, can you please tell our lovely listeners a little bit about yourself?
Yeah, so I'm originally from Austria, but I have been living here in the UAE with my husband for the last 4 years. And yeah, besides being the co-founder of Issy and Lilo, I work part-time at a school here in Dubai. I work as an inclusion teacher. So I basically work with a lot of children that have learning disabilities or difficulties. Yeah.
That's amazing. God, what an interesting career. And I mean, my first question is obviously going to ask. So this brand is relatively new to the market, Izzy and Lilo.
Yeah.
And the story that you told me is very interesting of how you kind of came to develop this brand. So do you mind telling us a little bit more about your path to entrepreneurship?
Yeah, because like my husband and I, we noticed a gap in the market for baby clothing that really cares for sensitive skin because I had a lot of skin issues myself. And then all my friends around me got babies, and I saw that their babies had like eczemas and rashes and irritations. So that kind of worried me, and I tried to find a solution. And because of my own issues, I did a lot of research on fabrics and I tried out different fabrics, what worked for me, what didn't work for me. So yeah, so that's when I came to the conclusion it's best for us when we try to open a brand that offers organic cotton and bamboo clothing, because for me those are the fabrics that work the best for my skin.
Amazing. I mean, can you tell us a little bit about your own skin issues and kind of where they came from and how you got to a point where you solved them?
Yeah, so like all of my life, I basically struggled with all kinds of issues. I had rashes, eczema, rosacea, and especially last year, I had eczema patches all over my body. So I didn't know what to do anymore. I had to go to the doctor so many times, and nothing helped, like no lotion, no medication, no nothing. Just sometimes I had to put ice, but when your whole body is basically full of eczema patches, you can't
Yeah.
put ice everywhere all the time, so that's not
Mm.
working. So at night I couldn't sleep. I felt hot, like I was hot and cold at the same time. So, and everything was so itchy. So when I was wearing a fabric that was a bit scratchy and
Yeah.
not completely smooth, it really, really bothered me. I couldn't sleep. And when I was wearing something that was completely smooth, so then all of a sudden I was able to at least sleep, you know?
Wow.
So yeah, and then I was diving deep into all the research about fabrics and how they affect our skin health, you know, and so on. So, and then I noticed for me, okay, for me, it works best when I wear something that is really smooth and breathable and soft.
Mm.
I couldn't wear anything that was a bit scratchy or no, I just couldn't. I couldn't take it really. It was really, really tough. And it took over 2 months until the eczema was gone. So yeah, but at least smooth fabrics really, really gave me a relief. And also bamboo clothing. I ordered a lot of bamboo stuff for me to try it back then. And it was cooling on my skin and it
Yeah.
was so breathable and it didn't really trap the heat, you know?
Mm.
So yeah, and since then I'm basically using only bamboo or organic cotton because the rest, yeah, I don't really wear anymore.
Oh my gosh.
Yeah.
I feel like this whole kind of education and movement around clothing and the materials we use in our clothes has only been discussed over the last kind of couple of years, I would say. I kind of think before that, I mean, when we were growing up, no one really thought about what materials were made of. And, you know, I can imagine that so many newborns and babies and toddlers and beyond suffered with skin issues, and no one ever really probably thought about clothing and
Sure.
what kind of things would work to soothe your little one's skin. But can you just tell us a little bit about newborn skin and why it's so sensitive?
Yeah, so newborn skin is up to 5 times thinner than adult skin, and it
Wow.
also, yeah, it's crazy because the protective barrier is not fully developed yet. So it takes up to 6 months until it's fully developed. So yeah, that's quite a while. So and because it's much thinner and more absorbent, toxins enter the bloodstream much more easily, you know?
Oh, wow.
So yeah, so it easily also loses moisture, and yeah, therefore it's also more susceptible for irritants and allergens. So yeah, that's why, especially for babies, it's so important for the first few months that they wear stuff that is really good for their skin, because
Wow.
toxins enter directly because the skin is our biggest organ.
Yeah, sure.
So yeah, for babies, that's especially a big issue because they also can't verbalize what's bothering them. They can't tell
Mm.
you, oh, look, this fabric is scratchy.
Yeah.
So yeah, they can't tell you. So yeah, it's difficult. So that's why it's important to care for baby skin.
Yeah, my gosh. And you mentioned there bamboo and organic cotton being two of the main things that were actually very kind on all skin, not just newborn skin. Can you just tell me a little bit more about the benefits of bamboo and organic cotton?
Sure. So bamboo fabric is basically very smooth, and like bamboo and organic cotton are both natural and gentle fabrics that yeah, I mean that have a natural origin, because for example, like acrylic or polyester, it's all petroleum based,
Mm.
and it contains microplastic. So then basically if your child only wears polyester dresses or whatever, or clothes, then directly the microplastic also goes into the bloodstream.
Oh my God.
So yeah, back to bamboo. Sorry. Um, yeah, bamboo, like it's smooth, it's anti-allergic, it's incredibly soft, and it makes it perfect for sensitive skin. And also, organic cotton is a safe version to use. It's free from harmful chemicals or pesticides, and it also offers a safe and breathable option, basically. And yeah, one thing I forgot actually, bamboo is also temperature regulating.
Oh, wow.
So
That's
yeah,
amazing because I know
yeah,
newborns really struggle to regulate their own temperatures. So that's
yes,
incredible. That's good to know. I didn't know that. And I'm guessing the
sure,
main difference between kind of cotton and organic cotton is the way it's produced and the way it's grown. Because cotton's
yes,
been on the market for ever and ever and ever. And, you know, when I was
sure.
growing up, all my clothes were cotton. Whereas this whole kind of trend of organic cotton has only been seen in the last couple of years. And I'm guessing this is a farming technique that they've introduced recently. Well, when I say recently, 5 years, 10 years?
Yeah, like the last years were extremely popular, but all the organic stuff like really got only popular in the last few years. Like
Mm,
it was a huge movement in the last few years, yeah. Yeah, but at least they don't use, because organic cotton doesn't use pesticides. They don't use pesticides to grow
yeah,
it.
sure, sure.
So
That's the main
but
point.
also you always need to check the qualities, because with every fabric there are different kinds of organic cottons, and there are different kinds of qualities in each fabric, you know.
Mm,
So yeah,
wow,
the best thing is always that you check that it's certified, that it's Ecotech certified, so that you on the safe side, you know.
sure. And I mean, in terms of like the worst of the worst, dare I say it, what fabrics should we really just cut out totally? What are the pits in terms of fabrics?
Yeah, so the worst fabrics are all synthetic fabrics like polyester, nylon, acrylics, because they are petroleum based. And as I said before, yeah, they are based on what's the name? The fossils, like what's the name? I don't know. Fossil. I don't know the English
Fossil
word.
fuels.
Yeah, this is the word exactly. And yeah, because they are petroleum based and they contain microplastic, it's the worst, because they also trap the heat, which also leads to a lot of irritation.
Oh my
Yeah,
God. Oh my
it's
God.
yeah.
Okay, so
Yeah.
they're being very. I'm really hoping that I don't have any of these fabrics in any of my children's bedrooms. But if they do, then they're vacating. I feel like there'll be a few Elsa dresses that will be going in the dustbin. God. And then, I mean, how can we tell if our baby has got sensitive skin? I think from the messaging that you're kind of saying to me, it's very important, regardless of if they have sensitive skin or not, that we really look at the types of fabrics that we're using on our little ones. But if they do have sensitive skin, what kind of things should we be looking out for that kind of like the red flags that they might be prone to eczema or might be developing some form of skin condition?
Like if you see some redness or dryness or rashes, you know, like red patches and stuff, you should, in my opinion, you should always go to the dermatologist first.
Okay.
Let them check what the real issue is, because you need to check, is it contagious, is it not contagious, where does it come from, like what laundry detergent are you using, which fabrics, or what were the environmental factors, you know.
Sure.
So you need to check many factors. So the first thing, like if you notice some irritation in your baby's skin, go to the doctor, let them check it. But when it comes to fabrics, you should of course only choose breathable fabrics like organic cotton or bamboo, and avoid synthetics like we said before. And also try to use a mild liquid detergent.
Yeah.
Yeah, because liquid detergents tend to rinse out more properly than the other, like the powder versions or whatever there is. So liquid ones are the best, and there are already so many things on the market that are for sensitive skin or for baby skin that have no fragrance in there, no dyes. So just fragrance free, without dyes, and made for sensitive skin. So that would be the best thing to do.
Okay. So
Yeah.
we need to be looking at our detergents too.
Yeah, of course, because the detergents can leave residues on your fabric.
Yeah.
So if it's not washed out properly, then also your child could react to it.
Yeah, sure. Okay. That is good to know. That is good to know. And I mean, when it comes to washing your clothes in particular, is there kind of like a go-to brand detergent that you like to use?
No, not really. Like there are so many things on the market, so I can't really tell you one brand that sticks out. Wow, like
Yeah.
no, there are so many things that are really gentle and fragrance free and without dyes and everything. Yeah. And
But do your
also
research,
what's
mums.
hmm?
But I was just saying, but do your research, mums.
Excuse me?
No, I was just saying the
Ah,
mums, they should do their research before they buy.
yes, 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 they should. And also, you know, like what you should really avoid, also what just came to my mind, is softeners and bleaches.
Okay.
So don't do this for your babies, you know. Especially, I mean, organic cotton and bamboo clothing, they are already very soft. So why should you have add softener in the first place? But you know, like softeners or bleaches, it's a lot of chemical stuff, so we don't need that for baby clothing.
Okay, that is good to know because that's something that I've never even thought of before. We always use fabric softener, but that is a
Oh,
good tip.
really?
Thank you. I'm going to be making note of that. And then coming on to your beautiful brand, can you tell us just a little bit more about Issy and Lilo and what you kind of stand for? What makes you guys unique?
Yeah. So, what makes us unique? Sorry,
Don't worry.
that was a stumble. So, like basically, was what makes us unique is that we care more for comfort and for safety,
Yeah.
and we want to provide peace for parents.
Yeah.
And we are not so much about fancy dresses and stuff, and the newest designs. We care more about the fabric and about practicality.
Yeah.
For example, our best sellers are our smart rompers, so you can undress your baby really fast and easy. So especially fathers love it, you know, like so easy with the zipper and quickly, you know. So we are not like number one fashion brand, but we care more about the actual practicality and the comfort.
I love that. And what is next for Issy and Lilo? What is next? What have you got on the horizon? What nuggets can you share with me?
So basically, like we're always excited to expand our product line and include even more baby essentials in our line. And we just want to be committed to the same quality and committed to sustainability as well. And we are also working to increase our presence in other markets. So we just recently started in Saudi Arabia.
Wow.
Yeah, and we are really surprised that we directly got orders from there and got a good feedback from the Saudi-based mothers. So that's really nice.
Amazing.
And yeah, and other than that, we are currently working with an artist. She comes from Dubai, like she is Dubai based, and her name is Namira, and she really does amazing art, like abstract, colorful, nature-inspired art. And yeah, we are working with her. Her studio is called Namira B Studio. If you want to check out her art, it's really nice.
Amazing.
Yeah,
So
so yeah,
she gonna be designing some clothes for you guys then?
yeah, like we will start with blankets.
Oh, beautiful.
Yeah, we start with blankets and then we see how to expand it and what to do if we put it on clothing as well, or if we stick with the blankets. So it's not 100% decided yet, but we are working on that at the moment. Yeah.
How exciting. Well, I, for one, cannot wait for this little bun to pop out of the oven and try your beautiful clothing because I have honestly heard such amazing feedback. So I'm very excited about trying it for myself. And if any of our listeners out there want to also give Issy and Lilo a go, where can they find you?
They can find us on Instagram. So also on Instagram, we have a lot of educational content. We share tips for mothers, and we also have a blog where we also share tips for new mothers. And yeah, so you can find us on issyandlido.com and on Facebook, Instagram. We also have WhatsApp. Yeah,
Perfect. And
that's
guys, I'm going
basically
to
it.
link this all in the show notes. So if you have any questions for Melissa or the brand, please do reach out directly. Melissa, you have been incredible. Thank you so much for joining us on Mother Tongue today. We've loved discussing this brand with you, and I will be feeding back very, very soon. Thank you so much.
Thank you. Thank you so much, dear.
We are so incredibly excited to welcome Dr. Monika, who is a specialist dermatologist from Health Bay, to Mother Tongue. Dr. Monika, how are you today?
I'm fine, and you?
Yeah, I feel like a baby hippo, but we're moving forward in the right direction. Week 23, and I feel like this baby is definitely growing. And I myself am actually starting to get some skin issues, which I didn't get in pregnancy number 2. I only got in pregnancy number 1. So I have so many questions for you today. But before we get into all the questions, can you please just tell our lovely listeners a little bit about yourself?
Okay. First, I'm so happy to be here and to help to help you with all the issues. I'm a special dermatologist, board certified from Brazil, and working in Dubai for 4 years. And I'm
Amazing.
passionate about dermatology.
Oh, I've lost you. I've lost you. Oh, you're back. You're back. You're back. You're back. You're back.
Yeah, it's freezing all the time.
Yeah, should we let's turn the cameras off. It might help.
Okay.
I actually don't.
Unless we need to switch to this one.
All good?
Let
If you
me
just
turn off because the Paulina is trying something different, but I don't think she will be able to. Let me turn this off.
click cam, there we go. That should
Yeah.
work. All right.
Okay.
Perfect. Brilliant. Okay, great. Are you ready? We'll just keep rolling.
I'm totally ready. My
Okay,
pleasure to
great.
be here with you and to help you, and all
That-
the girls that are watching us and hearing us.
Great. I want to start by asking, what are the most common skin changes that can occur during pregnancy, and why does skin become so much more sensitive during this time?
I would say that the most common skin change during pregnancy would be like stretch marks, hyperpigmentation, spider veins, skin tags, dermatitis, very dry skin, the melasma, that is one kind of the hyperpigmentation, and the itchy skin.
Yeah, so actually, I am getting the itchy skin at the moment. I'm about week 23, and I've started on my face and on different patches down my legs, been getting tiny little bumps that almost feel like hives, and they're really, really itchy. And my whole face has become so dry, and it's started to peel. I mean, is this kind of behavior quite common during pregnancy?
Yeah, it can be quite common, and it can get worse when you may have something before getting pregnant. I mean,
Ah.
if you before had any kind of eczema, if it was mild, it will get more moderate to strong when you are, during pregnancy. So if you already had a bit of dry skin, it will get very dry now, even more. So depends how your skin was before pregnancy. It can get even, more severe. But anyway, the itching and the sensitive skin also comes due to the hormone imbalances and hormone higher levels of the hormones, and also, as the baby grows, the skin stretches. So we get
Mm.
thinner skin, we get, very sensitive skin.
Yeah, it's so true. It's so true. And I mean, I think one of the hardest things is knowing how to treat these skin conditions during pregnancy, because obviously our skin is so sensitive
Yes, yes.
and there's
That's
only a
the good
few
thing we
things
have
that
to
we can
try.
use
I would say the
during this
first word
time.
would be
So in
preventing
terms of like
damaging the
pregnancy
skin.
safe
So we have to
treatments
go
and
like
options, what would you
not long
suggest?
showers. We have to take short period showers, like not more than 10 minutes. We have to put the water warm, like not really go into hot water, but trying to be warm to cold, and not more than 10 minutes shower. Always remember to moisturize your body and, all your body after that, and use gentle soap.
Oh, okay. And I mean, are there other things that we can use on our skin during this time? Because obviously there's so little that we can use during pregnancy because our skin is so sensitive.
Yes, we definitely have to avoid the parabenos. We have to avoid strong strong oily products. We have to avoid greasy products. We cannot uh, block the pores, so our skin has to breathe more now. And only the sensitive lotions and, like everyday lotions and the thinner ones are very good for the skin on this situation.
Okay, this is good to know. I'll be trying this. And can we just move on to now talk about
Yes.
melasma, or as people call it, the mask of pregnancy? Can we prevent melasma, or is it something that we're just going to get or not get?
We can prevent if we do apply the right sunscreen, and if we avoid the sun exposure, we can prevent. But anyway, there are some skin types that get likely more strong melasma than other skins. But anyway, the prevention is the most important thing. So using a good sunscreen, and usually the physical sunscreen, that can be the tinted one, can be the mineral one, are the best choice on the situation. And you do have to reapply at least 2-3 times a day. It has to be a 50 FPS.
Okay, okay, this is good to know. I need to definitely up my SPF game. And I mean,
Yeah.
look, if we are one of the unlucky people who get melasma, how can we treat it? Is it something that we can treat during pregnancy, or is it
Yes.
better to just wait until pregnancy is over?
No, we can totally treat it. So we can use some product that contains azelaic acid. We can even go a bit with glycolic acid with lower level percentage on it. And we can also use vitamin C. But I would
Okay.
say, if you don't protect yourself with the right sunscreen, you don't have to treat because you're gonna get, worse. So,
Okay.
and if you are doing both things, yes, let's treat and let's use some azelaic acid, some vitamin C, ceramide, niacinamide, things that can help. Yes.
So let's go on to the next question. Right. So, next up on the topic of pregnancy is pregnancy acne. Now, if you have acne, can this get worse during pregnancy? And if we do get pregnancy acne, are there safe treatments that we can use?
Yes, yes, there are safe treatments, and acne can get worse during pregnancy. So we usually the breakout happens around the first week, and the main routine for the acne doesn't not to get worse would be wash gently your face with a gentle cleanser twice a day. Avoid the facial scrubs because the skin on the pregnancy gets irritated very easily. So avoid the scrubs. Avoid oily and greasy cosmetics. Um, those things will be done to prevent. If you still have the breakouts happening, so we can prescribe some topical medications with erythromycin, clindamycin. That those are safe for pregnancy, totally safe. And we also have good options if we go with lower percentage of benzoyl peroxide or even salicylic acid, less than 2%, we can have good results. We can dry a bit the acne. Also, the azelaic acid, that's the same thing we use for melasma, can be used for acne.
Okay, cool. I mean, I actually have also, during both my pregnancies, experienced something called, I'm going to say this incorrectly, perinasal dermatitis, where
Yeah.
my skin has got an infection almost. Can you just tell me a little bit more about what that is and why it's quite common during pregnancy?
Yes, the perioral dermatitis, it comes because the skin gets totally sensitive and most sensitive around the nose and the mouth. And if we do use any kind of steroids or any kind of greasy creams or even vitamin C, anything on this area, the acne can come specific on this area. And the perioral dermatitis is the most difficult thing to treat because it takes a long time. And usually we have to give the patients antibiotics to control this.
Okay, and I mean, is it safe to take the antibiotics during pregnancy?
Yeah, we start with the topical antibiotics. They are totally safe, but it has to be the right one. So erythromycin or clindamycin are fine. And when it doesn't go fine, when you still have the breakouts, we can also try some oral antibiotics. We still have antibiotics that we can use during pregnancy. They can be azithromycin, clarithromycin, and yeah, they should be used if you have a strong breakout on your peridermatite.
Okay, this is good to know.
And
And then
the thing we really have to avoid, not to have the perioral dermatitis, are the steroids. We have to avoid buying things over the counter because if you go to the wrong stuff, then it will be a big problem to get it solved.
yes, actually, do you know what? I when I had this outside of pregnancy, I got it like probably about 8 years ago, and I remember the doctor prescribed me steroid cream, and it got so much worse, and it took months and months and months to get it better. But yeah, that is a very top tip. Say no to the steroid creams if you have this for
Excellent.
sure. And then moving on to stretch marks, which I feel is such a common question for so many mums who are pregnant. How can we avoid getting stretch marks? And is stretch marks something that sometimes is just down to genetics, or are there definitely ways we can avoid getting them?
I would say the stretch marks is a very common change on the pregnancy skin. And I think 90% of the girls will have it. We have to keep in mind the prevention. to prevent. So we have to stay hydrated. We have to moisturize regularly. Have a health diet. So we have to manage to just gradually have the weight gain. So control the weight gain. The skin will stretch, and as the baby grows, it stretches more and more, and that's why the stretch marks comes, because the skin gets sensitive. The elastin and all the elastin fibers start to break out and to break, so we're gonna have stretch marks. If we keep your weight, the weight gain controlled, and you keep exercising, health diet, and regular moisturize your skin, yes, you can control it.
Okay, and I mean, when you say moisturize, I know bio oil is something that lots of people really swear by. Are there any other products that you suggest we use to prevent stretch marks?
I would say I prefer more the lotions and the creams instead of the bio oil, because
Okay.
the bio oil in some situations they can give some acne on the tummy because they
Oh,
are,
wow.
yes. So you
Okay.
have the same benefit with lotions, but you have to keep in mind you have to apply at least twice a day.
Oh
So
my gosh. Okay.
yes.
I am definitely not doing it enough. I'm definitely only doing it like once a day, once every 2 days. So yes, no, I need to up my game for sure.
If you just apply a normal one, like a lotion for pregnant skin, or even you can use a lotion for baby skin, but you have to apply twice a day. You don't need to go for oil. But if you really like it, you can do sweet almond oil. You can go with a bit of vitamin A, C, and B, jojoba oil. Yes, you can do as go into massages. Yes.
Okay, this is good to know. And what about if we do get stretch marks? Is there anything we can do post pregnancy to help get rid of stretch marks, or stretch marks the kind of things that are stuck with us for life if we get them?
Now we have so many treatments that can help to improve these stretch marks for sure. So before you stop breastfeeding, we can start to use the retinols. We can do peeling, chemical peelings. We can go for sessions of lasers, also mesotherapy, microneedling. So there is a bunch of treatments that can improve a lot the stretch marks. Of course, we have to think about having at least 50% improvement. 100% will not happen.
Okay, okay. That's good to know. So make sure we look after our skin during pregnancy so we're not paying the price afterwards, is basically the rule of thumb here. I wanted to move on to moles before I ask my final question on pregnancy. Now, I have experienced so many different things happen to me with molds during pregnancy. I have moles change shape, I have moles change color, I have moles that kind of just grow out of nowhere. When should we be concerned about mole growth during pregnancy?
I would say that the changes on the old moles and getting new moles are usually very common during pregnancy. But the important thing is that if you had a big concern about one or more moles that you saw that got a totally different shape and it's bleeding or it's itching a lot, so you should come to for a dermoscopy. You should come to have a consultation with the dermatologist. But keep in mind that having new moles and have some little change on the moles are totally harmless.
Okay, good to know. And then final thing, when it comes to ingredients and materials, what should we avoid during pregnancy? What ingredients should we really not put on our skin during this time?
We should totally avoid the retinol. Well, we should avoid hydroquinone, things like Botox, adapalene, kinds of antibiotics, and a bit of the chemical sunscreen. I do ask my pregnant patients to avoid a bit the chemical sunscreen and just to prefer a bit more the mineral sunscreen and the tinted sunscreen, and to avoid also parabenos. So you have to look on your skincare when you go to buy your skincare. You just try to choose for one that has less parabenos, and so it will have more hypoallergenics and no perfume on this.
Okay. Well, now I would like to move on to newborn skin because obviously this is something that is also a big concern for new mums. Newborns are full of all sorts of wonderful issues, but what are the most common skin conditions that we can expect in our newborns?
I would say a discoloration of the skin, cradle cap, milia, diaper rash. We can also have the erythema toxicum. We can have acne, uh, a lot of dermatitis, sometimes very sensitive and dry skin.
Okay, and I mean, in terms of how we can support these, in terms of products that we use on our newborn, what kind of products should we be using, and what sort of products should we be avoiding?
Yeah, I think babes don't need a very elaborate skincare regime. Less is more in this case. So we can keep bathing to a minimum, to avoid removing the barrier of the skin. So you can bath the baby 3 to 4 times a week. You don't need every day to keep bathing your baby. And just make sure for the first few weeks, just use plain water. Then after 3 or 4 weeks, you can start using gentle cleanser, gentle soap, and very short showers, short bath.
Okay, cool. And in terms of like good products that we should use, lots of people say only use things like coconut oil. Would you suggest this, or is there anything else that you think is safe to use on newborn skin?
I mean, it's not safe to use very oily things on the newborn skin because usually the newborn can have like the acne, the milia, things that are already because of the oily production from the hormones from the mom, from the placenta. So if you go with oily things on his skin, it might, get some kind of acne on his skin and everything. So it's better to go to very gentle and neutral products. So we can apply like a calming comfort cream with oat milk. We can go for calendula. We can go just for normal things. I would suggest later a little some of the brands I like.
Okay, yes, please. That would be amazing. And then I can link everything in the show notes. That would be absolutely fantastic. Um, you obviously mentioned there also nappy rash. And I know this is really common throughout childhood, to be honest, throughout newborn into toddlerhood. Is there anything you recommend on how to treat nappy rash effectively? Because this can get really nasty, especially in babies.
Yes, we do have to change diapers, as more as we can, and we have to totally avoid the wipes. I would say the wipes are the very worst thing for the skin baby, the skin of the baby, because
Oh,
it
wow.
yes. So we should avoid the wipes, and we should try to clean with just like a little towel or even a cotton pad with a bit of water and very sensitive soap. Okay,
Oh,
and
wow.
we have to rinse. We totally have to rinse. We
Okay,
can.
that's
I usually ask my patients to apply on the baby skin the diaper cream. I like the ones that have a oxide zinc, so it protects. It's make like a barrier. The white one.
yes, yes, yes. Okay, great.
At night when the baby makes the diaper wet, if you have this cream on the inner part and on the genital area, it will prevent burning and it will prevent getting the contact dermatitis from the urine.
Oh gosh, amazing. Okay, please, if there's any products that you recommend, please list them over and I will link everything in the show notes. And
I
then moving on to cradle cap. Now, I know lots of parents worry about cradle cap. Can you just tell me the difference between cradle cap and dry skin and how should we treat each of these conditions?
Okay, yeah, well, so most of both are very common and they are harmless. Okay, I would say the cradle cap, it comes as patches, very oily patches that when we touch, they are sticky, and when we look at them, they are a bit more yellowish. And you can notice it more yellowish scales. When we talk about the dry skin, they are more dry flakes. and it has a bit of a erythema, a bit of a redness on the skin. So it's totally different. You don't see the thick plaque, and I mean the very thick one. If you apply some mineral oil, some avocado oil, I also put a tip for a good cream for the cradle cap. It will be removed by itself. And for the dry skin, you have to keep moisturizing, but it has to be moisturized with very gentle lotion.
Okay, thank you. Thank you very much for sharing that. And then just my last question is on rashes. Now, we talked a lot. We talked a lot to a previous guest about skin issues during the newborn phase and how we need to be really careful about the different types of materials that we dress our children in, especially our newborns, and how it's much better to go for bamboo and organic cotton fabrics. But in terms of a rash, when should we be worried, like seriously worried about a newborn rash? And when should we just maybe look at the materials that we're using and the products that we're using on our child?
The rashes are pretty common, but if the rashes go over most of your body and if you start to have like blisters or painful lesions, or spreading very rapidly, we need to, we need to take the baby to the doctor. Also, if it involves the eyes, lips, mouth, or genital area, and if it comes together with general symptoms like fever or, poor feeding, lethargy, coughing, then for sure we have to go to the doctor as soon as possible. But I would say a bit of rash is very common because the skin gets overheating with all the clothing that we put on the baby, and the skin is sensitive. They are not using with the clothing, so it can be normal, a bit of rash.
Okay, cool. So we definitely need to look at what we're putting on our newborn
Yes,
skin.
we need to prefer like loose cotton. We have to avoid synthetic products. We have to avoid polyester. We have to avoid tight, fabrics that get tight on his body. So yeah.
Okay, great. Now, before we round up today, Dr. Monica, we always ask our guests to leave us with one tip and one product based on the conversation. So if you were to leave us with one tip and one product, what would they be?
I would say that the Cetaphil Baby Daily Lotion. It's something you can apply on the skin. You're gonna have a good hydration without causing oily skin on your baby, without causing acne or any block of the pores.
Amazing. And what about a tip?
A tip is a tip that I like is try to rinse when you wash when you are trying to clean your baby, when you are removing the diapers. And don't forget to put the diapers cream. I like pretty much the one that has oxide zinc. There is a lot of brands, and you can rinse with thermal water. You can rinse with thermal water from Avene, from Uriage, even La Roche, any thermal water that has selenium and zinc. It will help the skin of the baby to get the healing very fast.
Okay, that is fantastic. Thank you so much, Dr. Monica. And for anyone who wants to reach out and ask you any further questions, where can they find you?
They can find me on Instagram, Dr. Monica with K, Figueiredo. I will let everything with you, and you can also share.
Yes, I will link absolutely everything in the show notes, everybody. So if you
Can
want
ask
to,
me anything on WhatsApp. Yeah.
brilliant. Well,
Yeah,
if you
on
want,
Instagram. Yeah, on Instagram.
if you want to reach out to Dr. Monica, I will link her handle in the show notes so you can reach out to her directly. And if you're in Dubai, everybody, she is at Health Bay. So if you'd like to book an appointment to go and see her, please do find her there. And as always, you can find us on Instagram at We Are Mother Tongue. And if you've enjoyed this episode today, please leave us a little comment. We always love to hear from you. Dr. Monica, you have been fantastic. Thank you so much for coming on Mother Tongue today. We loved having you as a guest. And hopefully we'll be speaking to you again very soon.
Yes, I hope so. Thank you so much, Mariana. It was great.
Thank you.